The CDC and Kaiser Permanente, which is a very big insurance company in California on the West Coast, okay? This study had 17,000 people in it. 40% of them were college educated. This was a very, very good study, okay? Now, on the back are 10 questions. All right, finding your ACE score. Now, for each question you answer a yes to, you get 1 point. Okay, now I'm going to start at the bottom and work up. Did a household member go to prison? Well, if one of your parents suffered from addiction, chances are one of them could very well have gone to jail. Number 9, was the household member depressed, mentally ill, or attempt suicide? Again, if you have a family member who's an addict, they're going to be depressed by definition. That's what addiction is. Number 8, did you live with someone who's a problem drinker or used street drugs? Was your mother or stepmother ever physically abused? Were your parents ever separated or divorced? Number 5, did you often or very often feel that your parents were too drunk or high to take care of you? Number 4, did you often feel that nobody in your family loved you? Number 3, were you sexually abused? Number 2, were you physically abused? Number 1, were you emotionally abused? Okay. So you can have a score anywhere from 0 to 10. Now if you flip it back over again and look right smack dab in the middle of the page, it says, for instance, a male child with an ACE score of 6 when compared to a male child with an ACE score of 0 has a 4,600% increased likelihood of becoming an injection drug user sometime later in life. There is nothing in all of the practice of medicine that increases your risk of a disease by that much. The other thing that's not said here, but if you've got an ACE score of 6 or higher, statistically you have a 19-year shorter lifespan. Now, if you smoke cigarettes, you have a 25-fold increase of getting lung cancer, which is half of a 46-fold increase. If you smoke cigarettes, it will statistically shorten your lifespan by 10 years, which is half of what an ACE score of 6 will do to you. Right? Now, these are statistical. I mean, not everybody who has an ACE score of 6 is going to die 20 years before other people. But I'm just saying from a statistical standpoint, okay? So childhood emotional trauma is a huge factor when it comes to addiction, all right? Now I've got a couple graphs. Well, I don't have the incarceration graph here up on the wall. But if you look back in the 80s, this huge increase we had in incarceration in the United States, one generation later coincides with this huge increase in addiction because we're very, very punitive towards people who have substance abuse problems, and that destroys families, okay? As we were talking about earlier, I was talking to one of you about this earlier, if you go in and survey women who are in prison, 80% of them have substance use disorders. Virtually all of them have been sexually abused or raped, okay? So in the United States, unfortunately, the paradigm we have is if a woman is sexually abused or raped, she becomes an addict, and then we throw her in jail. So if A equals B equals C, we incarcerate women in this country for being sexually abused. And that's really kind of the hidden epidemic that nobody's really addressing. You take the mother out of that family, you've destroyed the family, and you've created another generation of people who will suffer from addiction. Okay, so this is hugely important. But from a healthcare standpoint, 7 of the 10 leading causes of death are directly attributable to ACE scores. Yet when I give a talk to medical students and say, how many people in the room here have ever heard of the ACE study? Maybe 2 people will raise their hand, and usually it's 2 people who have been to one of my lectures. All right? This is the most important study that's ever been done in the practice of medicine, and nobody's ever heard of it. I mean, they're starting to hear about it a little bit, but this is hugely important when we're talking about addiction, okay? You know, they've been fighting this thing for the last 100 years that if we just take the drugs away, then addiction will go away. That's absolutely not true. If you look at this graph here, this is what they've tried to do for the last 10 years. Decrease the number of prescriptions written in Tennessee, and they've been successful at that. But look at the overdose death rates. It's going up exponentially. Because what happens when you shut a doctor down who's prescribing opiates? Do you think everybody just quits?
Get it off the street.
Huh. And now what's on the street? Fentanyl. 1 dose is legal. Okay. So, you know, in Tennessee, over the past couple of years, they've shut down half of the pain management clinics. Okay. And I went to a meeting not too long ago and said, you're killing people by doing this, all right? Well, a statistic came out a few months ago that half of all the patients or the people who have died in Tennessee over the last year from an overdose had been terminated by their doctor in the last 6 months. So you fire the people from their doctor, they can't get their legitimate prescriptions anymore, they go to the street, they take a fake Percocet like Prince did that's laced with fentanyl and they die. Okay. The only thing that works is treatment. You can't just take the, you can't get rid of the drugs. We've tried to do that for 100 years, you can't get rid of the drugs. So we've really got to kind of change our approach to where we deal with this from the standpoint of treatment. There's another, I'm going to have to borrow somebody's copy for a second. Another sheet in here. I think it's probably the last one. It says opioid maintenance, treatment, and reduction in mortality and crime. This is a study. I went to the International Society of Addiction Medicine conference about 2.5 years ago in Scotland. See, in Europe, I think you can see here, the United States has 2.5 times the mortality rate of any country in Europe. We essentially have the same addiction rate. It's about 10% across the cultures, okay? But we have 2.5 times the mortality rate because of the way that we approach it, all right? So we went to Europe to find out what they're doing there. And this is one study that they presented. Results: entry into OMT, that's opiate maintenance therapy, which is a Suboxone clinic, reduced the observed mortality by 50% overall, overdose death by 80%, drug-related morbidity by 75%, that's like hepatitis C and things like that, and crime by 60% or more. These findings are replicated and supported by meta-analysis from multiple international studies, okay? So we now have a drug that will cut the death rate of drug overdoses by 50%, and nobody wants us to use it. Now, if we had a drug invented today that cut the mortality rate of breast cancer by 50%, it would be on the front page of every newspaper. Okay? So we have a drug now that is essentially overdose proof, causes no long-term problems and no cognitive impairment, but nobody wants us to use it. So it's a little frustrating. I mean, there's a lot of reasons for that. A lot of it, like I said, is history, the whole war on drugs thing. But don't have time to get into that. That's a whole nother hour-long lecture. But again, you have to understand that there's a lot of prejudice against this disease. A lot of prejudice against the treatment. And those of us who prescribe buprenorphine, I mean, I have people argue with me who haven't even graduated high school and I'm board certified in addiction medicine, telling me that people just need to get off this stuff. And it's just amazing. I mean, when I was an ER doctor, nobody ever argued with me about anything. It was, well, I'm an ER doctor, I know what I'm talking about, but it's very, very different in the field of addiction medicine. Okay, does all of that make sense? Okay. So those are the two primary things that I want to talk about, the two causes of addiction, the genetics and the emotional trauma component. Let me say one other thing. In the yellow part there, at the bottom, it talks about a study that was done looking at people who were at the Vietnam War, who were taking heroin on a very regular basis, and everybody thought when they came back they were all going to be heroin addicts, right? Well, what percent do you think were heroin addicts when they came back? Everybody else just quit. So again, it's not the drugs that cause addiction, it's a pre-existing medical condition. And what I tell people is it's kind of like a mousetrap ready to go off. The first time you take a pain pill, you're going to be hooked. Okay? So we have to get away from this idea that getting rid of the drugs is going to do anything other than just exacerbate the problem. Because the other problem is, let's say you taper somebody off their Suboxone, what's going to happen to them? They're going to go right back down here. And they're going to live there the rest of their life. Is that a morally defensible position to take? I don't think so. I mean, if you live here, yeah, it's fine if other people live down there, you know. But to force people to spend the rest of their life miserable just so that they're not taking a medication, to me, is not a morally defensible position. But one other thing I was going to say about emotional trauma is it's not just childhood trauma. This will happen with adults too. A third of all people who suffer from post-traumatic stress disorder, if you take all the guys who go to war who have post-traumatic stress disorder, a third of them will become opiate addicts, okay? Because opiates help psychic pain as much as they do physical pain. But the single greatest group of people in the United States who suffer from post-traumatic stress disorder are women. It's usually from sexual assault. In the United States, it's estimated that half of all women in the United States have been subjected to sexual assault. Okay? That is another huge group of people who are just totally ignored by the addiction treatment community, unfortunately. And what we find is about 80% of our patients, 80% of the women that we see have had some form of sexual assault in their life. So that's, again, another huge, huge issue. All right, well, I'll stop there. Does anybody have any questions about any of that? Okay. Like I said, y'all are now experts on this compared to everybody else out there. Yeah.
Is Tennessee still putting women in jail that get pregnant? Like,
Fortunately, we were very instrumental in getting that law sunsetted. It was called the Fetal Assault Bill.
Yeah, it's horrible.
It was a law where if you're an opiate addict and pregnant and you don't get into treatment, then you go to jail. Now, they don't provide you with treatment or give you money for treatment, so a lot of women couldn't afford treatment because unfortunately, treatment, as you all know, is very expensive. And what they found when they did that is infant mortality went up, at-home births went up, out-of-state births. Women would stay at home and die instead of, if they were having vaginal bleeding when they were pregnant, instead of going to the ER and risk being put in jail. It was a horrible disaster, yet there were still legislators who were wanting to reinstitute that law. So, yeah, it's crazy. Yeah, the worst states as far as the legal, the laws regarding addiction treatment are, Tennessee, Virginia, Kentucky, West Virginia. Just very, very destructive laws. But anyway, yeah, that's a whole nother long lecture. All right, any other questions? Okay, well, I think we'll stop there, because we've got about 5 minutes left, and anyway.
Feel like the state, those 3 states, they want to help the people that's got the addiction, but they know what they can do, so they don't want to do it. Just feel like they just want to keep them there for some reason.
Well, I use the analogy of zombies. It's like in all the zombie movies and stuff. If you're not a zombie, they'll do everything they can to keep you from becoming a zombie.
Yeah.
But once you're a zombie, they just want to cut your head off.
Right.
Once you become a drug addict,
And
they don't want their kids becoming drug addicts. And they're afraid that you're going to contaminate them.
Mm-hmm.
But they're not realistic. Another way of looking at this is that there's 2 different types of diseases that exist. Chronic diseases like high blood pressure and diabetes, and true emergency diseases like Ebola. You don't want one case of Ebola in the United States, not one, okay? But if you try to treat high blood pressure like Ebola, what are you going to do? Just hurt people. Addiction is a chronic disease. You can't stomp it out. It is a part of who we are as human beings, okay? That's a whole other hour-long lecture why addiction exists, but it actually has a function, all right? Essentially what that function is it drives us forward as humans to achieve things.
Right.
Like I always say, if it wasn't for heroin, there would be no good music. Because what it is people who are musicians are driven to produce music because music is an endorphin releaser.
Mm-hmm.
They're driven to write good music and to perform because that's how they get their hedonic tone up. But when they can't perform all the time, they have to do something else to get their endorphin levels up. That's why so many musicians are addicts. So it's actually part of who we are as human beings. If everybody was happy, like there's studies that they've done on happiness, people who are 10s, they do nothing but sit at home and smile. They don't accomplish anything really. They don't go to college. They don't do anything. It's the people who are chronic malcontents, like you think about Elon Musk, the guy who came up with Tesla and all that. He is constantly, if you've ever seen an interview with him, he's constantly looking for something else to do because he's just a chronic malcontent. So it's adaptive for the species, but whenever you've got something like that, you've got a bell-shaped curve. So most people are 7s. People who are 10s, we call those people lazy. The people who are ones, we call those people drug addicts. Okay? But most people fit into this range, 6 to 8, something like that.